Recently, a new nursing law was passed in the Assembly plenary session, leading to a growing conflict between health practitioners. While the nursing union welcomed the law and called it a historic event, doctors and some nurses opposed it. The new law aims to redefine the scope of practice for nurses, giving them more autonomy and responsibility in patient care, which includes prescribing medications, ordering diagnostic tests, and performing certain medical procedures previously reserved for doctors. The opposition party led the passage of the nursing law, and the issue has become a political one. What is the nursing law? The nursing law is a newly enacted legislation that separates the content regarding nurses from the medical law. It covers various rights such as the rights of nurses and nurse specialists, their scope of work, improved working conditions, educational requirements, and prevention of human rights abuses. The key issue lies in the scope of work and improved labor conditions for nurses. Previously, nurses were restricted to working only in hospitals, but the revised law allows them to work in local communities as well. Additionally, nurses have poor working conditions, resulting in a high turnover rate. To address this issue, the nursing law includes measures to protect their labor rights. Mixed reactions to new nursing law in South Korea. Doctors and nurses' aides in South Korea oppose the newly passed nursing law, which they claim has become an exemption law for the nurses. The law permits nurses to work in local communities, raising concerns that they could potentially open their own hospitals without doctors. Additionally, nurses' aides fear that they will only serve as assistants to the nurses instead of aiding both doctors and nurses. However, nurses argue that the law does not permit them to independently open hospitals. Current status and potential outcomes of the nursing law. Despite opposition from doctors and nurse aides, the nursing law has been passed. However, the government and ruling party have proposed a compromise to address concerns raised by the medical community. Nevertheless, the opposing party and nursing union have not accepted the compromise, and the only option left for them is to request the president to veto the law. If the law is vetoed, there could be backlash from nurses. Therefore, the government must find a way to mediate the conflict between nurses and doctors to ensure a positive outcome for both parties.